Bahamas, you're tuned into NB12 Weekend, broadcasting from Cable 12 Studios on Robinson Road. Coming up tonight in news, health officials allaying fears of Ebola in the Bahamas. A look at the Central Revenue Agency. The business community prepares for VAT. Plus, a leading pastor commends government for postponing the gender equality referendum. I'm Paige McCartney. We've got those stories and more straight ahead on NB12 Weekend. Welcome once again to NB12. Days after rumors of a Ukrainian man being diagnosed with Ebola spread over social media, health officials confirmed today that a sample sent to the Center for Disease Control last week has tested positive for malaria, not the dreaded Ebola virus. They also responded to criticism over their response to rumors. Our Jasmine Brown has more in this report.
Today, those health officials also addressed rampant internet rumors and also revealed why they took so long to respond. During that press conference today, Minister of Health Dr. Perry Gomez revealed that the CDC results confirmed their suspicions.
All tests done were negative. The patient unfortunately died on Wednesday, the 17th September at 7:56 p.m.
According to health officials, the patient diagnosed with malaria was a 34-year-old white male from Ukraine who was airlifted by the U.S. Coast Guard. He was aboard a freighter passing through Bahamian waters. It was not until Wednesday night that Dr. Gomez announced in the House of Assembly that a bogus claim was posted on the internet about a case of Ebola in the Bahamas. Today, Dr. Gomez and his team addressed criticisms that the health ministry took too long to respond. Gomez insisted he addressed the Ebola concerns in the best forum he could and as quickly as was allowed.
The minister wasn't aware of it till late that evening, that how viral this thing got. And that is why the response was made from the House of Parliament, because we were in session. And the only time we could do it was at the end of the session. We had to wait until Parliament was finished for me to make a statement. And that turned out to be very late at night. But it wasn't entertained until, I would say, around 6 o'clock, when we appreciated how viral the thing had become.
Princess Margaret Hospital Administrator Mary Walker and Chief Medical Officer at Doctors Hospital Dr. Charles Digges both insisted protocol was followed.
It is a very stringent protocol page, and we all are part of the surveillance network within the country. It is a very stringent protocol. The persons who can speak are here in the ministry, and that is either the Chief Medical Officer of Health or the Minister of Health when it comes to disease protection for the country. It is an established protocol, and it will always follow that established protocol so that misinformation is not out there. However, social media being what it is, we cannot absolutely control that. But when we do speak, we will speak with the authority of knowledge.
But the collaboration is significant. Collaboration happens at nighttime when most of us are asleep. The collaboration in this particular case did happen at nighttime, and the team applied all the appropriate management, but we weren't able to give you information until we got it and collaborated with the ministry because of the public health implications of that diagnosis. So we remain mindful that there was a need. We had a conversation about whether that was an opportune time to release information to the public. We understood that the priority needed to be the care to, treatment of the individual, the protection of the institution, and the collaboration between public health and ourselves to make sure that the overall Bahamian health was not at risk. So the minister released information, and then here we are again with confirmatory information on whether Ebola existed or not. And I think we met our responsibility impressively with the cooperation and collaboration between both facilities.
In addition to the internet posts, several voice notes were also circulated with persons claiming to be medical personnel in the Ministry of Health and Doctors Hospital. CEO of Doctors Hospital, Charles Seeley, says an international investigation was launched.
In listening to all of them, there was no immediate information to suggest who it was from. I can speak very comfortably and say that there is a stringent protocol in the institution that we maintain privacy and confidentiality of our patients. To the extent that an investigation was launched in our institution, the answer is no as to whether one of our persons may have offended the protocol. I can assure you that if that is found to be, and then there are certain actions we will take internally to deal with the same.
Moving forward, health officials say they have a stringent screening process in place to ensure staff and members are properly trained to handle any case of Ebola. Reporting for NB12, I'm Jasmine Brown.
Well, the government's point man on value-added tax said the agency designed to administer the new tax is on course to be up and running in time for VAT's January 1st implementation. Speaking with NB12, Financial Secretary John Roll noted that the Central Revenue Agency, which the government hopes will eventually oversee its VAT, business license, and real property tax departments, is still in the works and would begin operations as early as January 1st, 2015.
The Central Revenue Agency is a process that's well entrained. There's no pause to that process. The Central Revenue Agency, as you will know it, will be VAT, business license, and property tax. They're all going to be operating out of the same facilities as early as January. So in terms of them becoming more integrated, that is a process that all of the staff who work in those operations will see very visibly in January.
He added that the VAT and business license departments will be closely integrated following the establishment of the CRA. However, Roll did not specify when the agency would be operational, echoing comments made by Minister of State for Finance Michael Halkitis, who suggested last month that government would establish the CRA within 12 to 18 months.
Right now, there's work to make changes to the business license systems and process. Business licensing is going to be operated on the same platform as VAT. So the computer systems that are being installed to deal with the VAT administration, we are going to be administering business license on that same platform. And so from that standpoint, the business license department is intimately involved in terms of the preparations and looking at how that process can be modified to fit into the framework. So we're already in the mindset in terms of staff in those operations that they are going to be one. So it's going to be a lot more than just a particular date on which we draw the line and say we step across that date in the CRA. The CRA is a process that's happening.
Roll addressed the government's VAT education initiatives with the private sector, claiming the ministry is comfortable with the progress made.
Going forward, we are beginning now to go into businesses, sit down one-on-one with the businesses and understand what their issues are and give them the comfort that they're doing certain things the right way, or if necessary, give them the guidance to help them move in the right direction.
VAT will be implemented at a rate of 7.5% effective January 1st next year. The CRA, which will help administer VAT, was not included in the VAT bill tabled last month. The revised bill also eliminated the establishment of a revenue court to prosecute VAT and other tax evaders. While concerns about businesses cooking their books to evade paying taxes following the introduction of VAT have prompted President of the Bahamas Institute of Chartered Accountants, Darnell Osborne, to send a warning to those professionals charged with ensuring compliance. She said, however, that VAT is a very accountable tax and that at each step of the process it would only benefit companies to keep accurate books and records so that they can claim their credits from government.
It really will not benefit businesses or accountants to assist them in doing that. And obviously any member of our profession who, for whatever reason, may want to do that, there's a disciplinary process with the Institute.
And as VAT implementation draws near, Osborne said the organization is working diligently to ensure members and their clients are prepared for the major tax policy shift.
People are just interested in really getting a lot of information so that they can, accurate and relevant information so that they can alleviate the fares and also inform their One of the key things was pointed this morning by Mr. Roll was that for businesses really, there will be no additional cost per se directly from VAT because businesses really are just going to act as a conduit for the government in terms of collection of taxes that the consumers will be paying.
Osborne was speaking at a seminar for BICA members, which covered topics such as transitional arrangements and the registration process, along with industry guidelines. And reaction from the business community to value-added tax has been mainly negative, with many fearing that tax will cripple their enterprises. However, one businessman believes VAT is a good and necessary tax that he has no problem with. Owner of Rocky Farms Nursery, Bruce Pinder, said he anticipates a slowdown in his business come early next year, but he believes it will level out once Bahamians get accustomed to the new tax.
I think it's going to be a slowdown on the business to start off with. The effect of the psychological effect on people just knowing that they have to spend 7.5 cents out of every dollar. But if you look at every country in the world, like the U.S., we go to the U.S. and we pay 6.5% in Florida sales tax to begin with. So I don't think that it's harmful for the country. I don't think it's harmful for us. We got to find money to pay these bills we owe. And with the infrastructure that we put in place, the roads and the stuff that is in place now, we see where the money was spent. We know we have to pay our bills. We need to cut down on a lot of excess expenditure, which is a lot of that going on. But I think it'll be overall, if we do it right and we monitor it right, I think it would be good for the country. And
Pinder said since it will be mainly the consumer who will experience the weight of that, he's not concerned about potential losses.
I think value-added tax would be good for the country because it's going to bring our revenue up. If they cut off the custom duties to compare with the VAT, which the service industry will pay the VAT, and now the service industry is not paying anything to the country. They do pay indirectly through businessmen who import, but I think it would help and make more revenue for the country with the 7.5% that they're going to come up with.
And in other news tonight, a police officer was injured early this morning when a motorist refused to stop during a police operation. Reports are that the officer was a part of an operation on Blue Hill Road South at around 2 a.m. He signaled the driver of the vehicle to stop. The driver, however, refused and instead allegedly attempted to drive in the direction of the officers, injuring one of them. According to the report, police feared for their lives and subsequently fired several shots at the vehicle, hitting the driver in the hand. The officer's injuries were not life-threatening, and the 34-year-old driver is in hospital in stable condition. And police say a 33-year-old American man is in custody for questioning after an American woman claimed he attempted to have unlawful sexual intercourse with her overnight. The woman told police that she met the man 2 days ago at a Paradise Island resort. Investigations continue. When NB12 returns, more on preparations leading up to VAT's implementation. Stay with us.